Hi, my name is Christina Osborne. I am a registered nurse on a medical surgical floor at Millard Fillmore Suburban Hospital in Williamsville, New York. Currently, I am in the Family Nurse Practitioner program at Upstate. After graduation, I am unsure of my preferred work setting. Although I will have authority to see patients across the lifespan, I particularly enjoy working with the geriatric population. Recently, I cared for a patient who had been diagnosed with Lewy body dementia. Lewy body dementia is a progressive brain disorder in which Lewy bodies, which are abnormal deposits of alpha-synuclein protein, build up in certain regions of the brain. Currently, it is estimated that Lewy body dementia affects 1.4 million Americans. Lewy body dementia is characterized by progressive cognitive impairment leading to full-blown dementia, Parkinsonian motor symptoms, visual hallucinations, and fluctuation in levels of alertness and visual acuity. Other symptoms include acting out dreams, which is known as REM sleep disorder, and disturbances in autonomic functioning, including low blood pressure, constipation, and urinary frequency. With symptoms that closely resemble that of Alzheimer's and Parkinson's disease, Lewy body dementia is actually often underdiagnosed or misdiagnosed. From talking with the patient's family, I learned that it was a frustrating and lengthy process for them to receive a proper diagnosis. Due to the lack of widespread knowledge regarding the disease, I thought that resources specific for Lewy body dementia would be particularly helpful to patients and their caregivers. A Lewy body dementia diagnosis is life-altering for patients and their family members. Although the progression is variable, the typical lifespan after diagnosis is 5 to 7 years. For those closest to the patient, it often means assuming the role of caregiver, which brings with it new challenges and responsibilities. Often, the greatest challenge for caregivers is developing confidence in their ability to do what is right for the patient. Feelings of isolation due to lack of awareness about this disease were also found to play a role in caregiver burden. Other sources of stress for caregivers include coping with behavioral and emotional symptoms of the disease and assisting with activities of daily living. At first, I reviewed the Family Caregiver Alliance website and the Alzheimer's Association website, which both provide information on Lewy body dementia. However, I chose to review the website of the Lewy Body Dementia Association because it is specific to this particular form of dementia, and I think it would be the most helpful in terms of understanding this specific diagnosis and disease progression. The website is www.lbda.org, and it is created by the Lewy Body Dementia Association. To determine credibility of this site as a source, I utilized the Source Educational Evaluation rubric. I determined that the SEER score was a 3.4. This site is a leading source of content on Lewy body dementia, with information provided to inform users. It is high quality and provides thorough coverage. However, the site does not contain all original content and viewpoints, and not all pages are cited. Although not all pages are cited, there is a link to a page about the LBDA Scientific Advisory Council, which is a group of researchers and clinicians that provide the information used to create any publications by the LBDA. The page lists the Scientific Advisory Council members and their credentials, with most of them being PhDs and MDs that run research centers and clinical departments at universities and their affiliated healthcare facilities. The first thing I want to talk about is the Lewy Body Dementia Association's mission. It is that through outreach, education, and research, we support those affected by Lewy body dementias, their families, and caregivers. We are dedicated to raising awareness and promoting scientific advances. And I think that's exactly what this website does. It helps patients and family members develop a better understanding of the disease and provides multiple opportunities to receive support as they learn to live with this new diagnosis. Under the section Learn About LBD, patients can walk through a couple different clickable links. What is LBD? Is it LBD or something else? Which is specific to the fact that many times there are misdiagnoses of Alzheimer's or Parkinson's of this disease. 10 things you should know about LBD, diagnosis, symptoms, and treatment options. Next, I want to mention the Research tab, which is where patients can go to find information out about clinical trials. They can enroll in clinical trials. There's summaries of the latest research and information on the centers that provide this research. Under the About Us tab, patients and families can find out more about the Scientific Advisory Council. There's information about the Board of Directors, milestones in the history of the association, and contact information. There's also a Ways to Give tab, which discusses different events that are held by the Lewy Body Dementia Association, fundraising opportunities, and ways to volunteer. The part of the website that I really want to focus on is the Find Support section. In this section, there's a lot of information for family caregivers. There's books on Lewy body dementia and dementia caregiving. It's a link with a list of resources. There's also a link to the Lewy Digest, which is a place where patients and family members can go to sign up and receive information on clinical and research advances, stories from other patients with Lewy body dementia, and receive other educational information. If we go back through the Find Support tab, we can come to some other information, including the Lewy body dementia caregiver link. Under this link, people and their families can be connected with a Lewy buddy, which is another caregiver of somebody with dementia. They can talk via phone or via email. So that's just another way to receive support. There is also a section where people can share essays on Lewy body dementia caregiving. Although it doesn't look like it's currently loading here, there's normally a bunch of links to different stories and poems written by family members of patients with Lewy body dementia. Next, we're going to go back to the Find Support page again, and if we scroll down to the bottom, we find that there is links to local support groups. If you click through this link, it'll show a map, and you can search by location to find support groups in your area. Under the virtual support groups, there's a section where there's a list of communities for people to become a member of, including caring spouses, caring partners, those living with the disease. There are Facebook groups that people can join to discuss things and to receive support. I noticed under the one for Living with Lewy Facebook support group, there's actually virtual Zoom-based support groups, which I thought was kind of neat and useful for patients and their families. Next, I want to draw attention to the caregiver resources, which is a list of information on different organizations like the Elder Care Locator, National Adult Day Services Association, National Institute on Aging, and then these couple for end-of-life planning, Caring Connections, and palliative doctors. Obviously, with this disease, eventually the end is end of life, and during the time that the patient's still alive, there are going to be a lot of issues with being able to care for the patient, so it's important that somebody is able to access these resources if need be. There's also a link to related organizations that discuss Alzheimer's and Parkinson's related associations, which are important as they have aspects of this disease that overlap. So this information might also be useful to a patient and their family members. The last section I want to discuss is under Caregiver Materials. It's called Caregiving Briefs. And this section is important because these care briefs can be used to help the patient's family members, friends in the family, healthcare professionals understand a little bit more about what's going on with this disease. If we scroll down the bottom here, there's looks like 7 care briefs. These care briefs were developed by a family member of a patient who had Lewy body dementia, and they were used to inform, family, staff members, anybody involved in the patient's care. You can see they're listed behavioral changes, introduction and overview, causes, non-drug strategies to manage these behavioral changes, as well as one on medications. If we click into them, any of these come up as printable worksheets, which you can print out and bring with you or distribute to whoever you would like. A family member of the patient that I had under my care in the hospital actually brought in a couple of pamphlets like this to us to go over what Lewy body dementia was and what some of the behaviors are. One of the important things in noting with this disease is that some medications can cause serious side effects in patients with Lewy body dementia. There's a risk of causing neuroleptic malignant syndrome, which can be deadly. There's a risk of worsening the cognitive impairments and Parkinsonism-like features of the disease, sometimes irreversibly. Family members in this case are often involved in making sure that healthcare professionals are informed, and this website can help them do that as well. A few of the other care briefs that I thought were particularly helpful were the causes of behavioral changes, which discusses different environmental factors that might worsen behaviors. As you can see, it has a list here. The other brief that I thought was really helpful was non-drug strategies, both of these actually, that may prevent and that to help manage behavioral changes. Nursing professionals, we can help patients and their families by providing them with information and support in our presence and by linking them with resources that can assist them in doing so at home. For patients with Lewy body dementia and their caregivers, the Lewy Body Dementia Association website serves as a reliable source of information and connective link to support groups. Caregivers and patients can use this information to help inform themselves, friends and family members, and those in healthcare to have a better understanding of the disease. Thank you.